Hey, it's Tess, content creator, model, presenter, and host of the Tess Talks podcast, on a mission to ignite curiosity. Hello, ladies, all my pregnant lady friends, mums, or just women looking to empower themselves pre or post conception. This episode is for you. Gabrielle Brennan is a registered nurse, midwife, and bodywork specialist who is joining me on today's episode. She provides groundbreaking bodywork techniques to help soften the pelvic space, to support a pain-free pregnancy, and encourage optimal fetal positioning for birth. There are so many incredible tidbits in here to empower all women in whatever stage you're in your motherhood journey. And at the time of this recording, I spoke about how my baby was in the breech position at around 32 to 33 weeks. And honestly, after just a couple sessions with Gabrielle, my OB managed to move my baby into the optimal birthing position in literally about 20 seconds, avoiding having to do an official ECB. He was incredibly impressed with the softness and response from my body, which I put down to all the lessons and the work that I had done with Gabrielle. So get ready to feel empowered in this episode and take control over your body, your baby, and your pregnancy and birth experience. Let's get curious. Gabrielle Brennan, thank you so much for coming on my podcast.
No worries. Thanks for inviting me, Tess.
I'm really excited to have you on. I'm not going to lie. When I started my pregnancy journey and started seeing different practitioners and facilitators, your name came up a lot within the industry. Ooh. So in the best way possible.
Yeah.
So that's when I was like, okay, I need to book in and see you. And I'm so glad I was able to get in because you are a busy lady.
Yes, I am quite busy. I try not to be, but it's really hard when you have so many people with so many really good goals and you know that you can help them.
Yes.
So my problem is like I can't really say no. It's really, really hard to.
Yeah.
But I love the work.
Well, I bet your clients are very grateful for that.
I hope so.
Everyone wants
I work really hard.
Yeah.
So I hope that comes across.
Totally. Yeah. So you are by profession a nurse, a midwife, a personal trainer, and an expert in birth and pregnancy bodywork.
Yeah.
So I think it'd be awesome if you could elaborate a little bit on exactly what the ladder of that means and a bit about your background, your experience, and kind of how you got to where you are today.
Yes, I love this one. This
Great.
is what I say in like half the sessions with my clients because they all say the same thing. They're like, I've never heard of a midwife body worker. Like when you hear body worker, most people will think of like myos or chiros or osteo, like your more traditional. And so the midwifery body work is all about working with mum and baby. And so I really keep that at like the center of my work. And people will still be like, but what does that mean? And I'm like, well, I work with you and your baby to work out what you might need to then support you in your labor and birth to achieve, for a majority of my clients, it's going to be, most of them have a really strong goal for a physiological birth. So that means like the least amount of intervention as possible with all the typical physiological outcomes. Yeah. So think of it also like, it's quite subtle and gentle work, as you felt. I like to think a lot of it's really fascia focused.
Yeah.
Because that nervous system and that connection with mum and baby is kind of where you get the beauty of the work. A lot of people are like, press harder. And I'm like, I don't need to.
Yeah.
I shouldn't have to.
Yeah.
Because if I have to press harder, your body's saying no. To some degree, it's saying, like, you're not allowed in here, you can't do this work. And so when it's quite gentle and really focused on, the body's not responding here to this particular like fascial technique, can I investigate why? Why does it feel like it's holding on? And unraveling that onion and peeling back those layers and being like, well, why doesn't the body want to respond? You get this really beautiful shift in not only people's comfort, but also nervous system, which is really fascinating. A lot of people get really sleepy or really giddy, or have this beautiful emotional release after a session. And you will notice almost instantly the baby just wiggling around and being like, the space is changing.
I definitely did. Just like you're about, I haven't actually told you yet.
Yeah.
So how did your work from, say, midwifery transition into being more involved with body work?
Yeah, so it started pretty early into my midwifery career. I've been a midwife for about 7 years now, so a long time. But it was probably at the really early on 2-3 year mark out that I was in this specific birth where It was a multi. It was her third or fourth baby, first induction. All of her previous babies were normal vaginal births, no problems. Like absolutely no problems. And this one, she chose an induction for whatever reason and had an epidural, which she'd never had before, and then just didn't progress in her labor. I didn't have the skills to help her, and she ended up in a cesarean.
It's a common story, isn't it?
Such a common story. And with that birthing history, you would be like, why? Why? This doesn't make any sense. And it was kind of like the cherry on top, having been in so many of those births and just not having the skills. You'd be shocked at how little skills midwives are actually taught.
That's really surprising.
It's really sad.
Yeah.
I feel like, not that I can really remember 10 years ago at uni, but I just don't feel like it. Maybe they talked about it a bit, but anyone who kind of has like a lot of the bodywork skills have typically done extra courses and training. Like it's not like, that's not the midwifery degree focus. I feel like it was a lot more, here's your antibiotics, this is how you break someone's waters, like this is what the normal progress of labor is. And it's just, I don't feel like it really equipped me for the work in a hospital where we're so disruptive to the space and birth.
It's so interesting, isn't it? Because I do feel like that is a bit of a common story, especially within Australia and probably the US, is that we have a very specific way of treating things. And I've spoken about this in previous episodes when it's more so around just treating our general health. But I think it's very similar in this scenario, is that we have our one way, and a lot of that is very intervention heavy.
Very.
And I guess that does come down to the education that we get throughout medical school.
Yeah. So I think that's why, I just wasn't super equipped as a midwife. So then I did a whole bunch of different courses and went, holy shit, there's so much capacity to work. Oh, sorry. Can I swear?
You can swear. Okay. Nothing's off limits here.
Australian potty mouth. I was like, oh no, I'm totally going to swear.
It's not the best time, don't worry.
No, I can't even remember what I was saying. I was like, holy shit, I cannot believe how easy it is to actually work with mums and babies. I could not believe rolling someone to their side and doing a little movement of their sacrum, how much easier it is for a baby to move out. Like all these labors that weren't progressing and doctors would be like, oh, she'll have a cesarean. Like she's just not getting anywhere. And I'm like, just hang on. We've induced her. We've disrupted her body and her baby. Can we just look at it from a different perspective rather than, oh, it's not working, which it gets to me now when people are like, oh, that just won't happen for her. And I'm like, you don't know because you haven't tried anything. You just looked at her and said, oh, that's not going to happen for you. You're 5 foot. How can you birth your baby?
Totally,
and I'm like,
yeah.
She can't birth a baby. You grow a baby for your body. Like there's so many different instances that I'll get my back up about because I'm like, you don't know. Do the work, support the body and baby, then see. Yeah. Because the baby will tell you.
And that's what I love about your work is that you keep referencing the baby as well. And I feel like that's probably overlooked. It's just kind of looking at like the mother and how the mother's progressing. And the way that you work with your clients is that you really listen to the baby's responses. And that's what I found really interesting when I was working with you. And so you're like, okay, tune in. When's she kicking? What am I doing at that point? When is she getting most active? And so you're really working in harmony with me or the client and the baby. And I think that's quite unique.
I worked it out rather early on in my practice that, because sometimes you can have that, oh yeah, I kind of know, like you've got this particular pain, I would find tension in these particular spots, but the baby wouldn't change their position. And a lot of my work is about supporting baby into a different position for birth.
Yes.
And you're using mum's aches and her body and everything like that to get extra information, but the baby knows everything. They know everything about the space. They just can't communicate it in the way that most people would understand it. And so with my work, it's about how can I understand the language of the baby? And you can do that through the lens of the mother because you're the next best person to know your baby, but also like the baby will show you straight away. Like I might feel someone's body and be like, oh, I think this is going on. And then I'll do the work and the baby does nothing. And I'm like, what? This makes no sense. And then I'll investigate it a bit further, peel back the onion layer and go, oh, the baby needed this to then relax that, to then change that. And then the baby's like, great, my space is open. Let me move there and investigate it. So
fascinating. So I definitely want to tap into a little bit of the modalities and how you like look at the body. But I think it would be really cool to start with, I guess, just the general importance of preparation for birth. Why do you think that it's so important? And what are some of the signs that women should look out for in their own body when they're pregnant to kind of think bodywork could be really good for me? Or should everyone be doing it?
I think everyone should do it. But with anything, more people are going to find there's benefits compared to others. Like not everything's going to work for everyone, but some people it'll work beautifully for. And pregnancy aches are like the number one thing that I'll harp on and on about, because so many people dismiss people's pregnancy aches and say, oh yeah, you're pregnant, of course you have back pain. Like, yeah, why are you complaining? And then that poor mother shuts her mouth, doesn't say it to anyone else, and then her body will either say, oh, you haven't addressed this pain, we're going to make this more intense. What's the flow-on effect then to her body? What's the flow-on then to her birth? Or because someone shut her down when she said, oh, I've got a bit of back pain. I'm a very strong advocate for, if your body's communicating a message, you need to listen and act upon it. And sometimes it's trial and error, because people will know their bodies better than others. It's a skill, you've got to practice. But in terms of the birth prep, listening to your body's aches and the tension and the discomforts will guide you as to what you need to work on. Because for a baby and their positioning, you want to make sure everything's as soft as possible so that they have the most amount of options to choose. That's all we're giving them. We're giving them options A, B, C, D, and E to get out, as opposed to a baby working with A, B, and C. Like maybe they needed E to get out in the most effective way. Maybe they're happy in B, but we've given them options to choose the best way out. And best way out will often correlate with less discomfort in your labour. Sometimes it can be a faster labour, not always. Sometimes it will reduce a lot of interventions in a birth. Like I cannot tell you how many times I've been in a birth, because I practice this when I'm working with women in labour.
Yeah, right.
And I can't tell you how many times I've gone into a room, they're like, oh, my back pain, it's so much. I think it's posterior or whatever it is. And then I'll just ask them, oh, what are your pregnancy aches? I'm referencing one specific birth.
Yeah.
This was awesome. And she was posterior baby, spont labour, slow-ish progress, was using the gas every now and then, could not get comfy for the life of her, crushing back pain, just getting worse and worse. And when I came on, I was like, okay, well, your body is cueing, this is the space that we need to work on. That's why you're getting the pain there. And so I asked her, what were your pregnancy aches? And she was like, oh, I got this horrific, like right-sided sciatica, really awful glute tension. I was like, where does your baby normally sit? Oh, it's always on the left. Does it ever move to the right? Nah.
Interesting.
Is that space closed off for the baby? Is the baby just making the left work? And now they're trying to rotate to get to that right side they always intended to. Is that why your labour's still your 2-3 centimetre mark? Maybe. Did a little bit of work with her. I couldn't get her in the position that I would typically do the work because she was just in so much pain. And she was starting to get that progression to the urge to push, which we'll see a lot when there's the body's trying to troubleshoot more pressure to turn a baby. And the baby's like, I can't get there. And the body's like, all right, we're going to get mum to push down on you so you can get there. It's kind of like more pressure at the bottom end of like a bottle of sauce or something. Like you're just giving a bit more pressure to get it out. And we did a little bit of light work on that right glute that had all the tension, assuming that's where baby wanted to go. I couldn't even feel baby because she was in so much pain. I couldn't get her to lie down. And it did a little bit of work, 10 minutes. Her pressure completely changed from intense back pain to just, this is a lot. This is very intense labour now. And she birthed in a couple of hours, unintervened. Definitely settled the back pain, but it progressed to like, oh, this is labour.
Wow.
Yeah.
It is so empowering to know because we're not really given these options and then it's kind of straight to, okay, not progressing, let's intervene. But you're right, there are so many signs.
The next thing that would have been offered to her would have been an epidural because, how dangerous of you to push on an undilated cervix. It's going to swell. And it's like, it's going to swell because the kid is not in the best position it could be. Not because she's pushing on it. She's trying to troubleshoot it and you've just bypassed her body's intelligence.
It's so interesting because from my experience working with you as well, and I guess also really highlighting how you do use such a gentle approach, it was just from the subtle movements and pressure that you were putting around my glutes and my hips that you realized where there was tension. And as you were doing that, the baby started to respond and you picked up things like my right abdominals were tight and that could be stopping my baby from turning. So for anyone listening who doesn't know, my baby is in breech position currently and that's why I've been working with you. But it's amazing seeing how so subtly workshopping my body and tweaking a few things of my weekly routine with exercise and stretching and things that I'm doing is helping my baby to become more wiggly and movey and hopefully flip. And it's almost as simple as that.
Yeah. Breeches are tricky.
Yeah.
Because they're not a bad position. They are a variation of normal, but they're villainized because we as birth providers don't have the skills to actually make them as safe as they could be. And that's the problem. It's not a breech baby, it's the providers.
I definitely do want to get into breech and I guess different babies' positions. But I think I just want to delve a little bit more into what you commonly see and what are some of, I guess, the most common things that you can treat for anyone listening.
Yeah. So I always like to use the word support rather than treat. Treat just kind of sounds like there's a problem.
Yeah, I love that.
Nothing I see is a problem. It's like a pathway to be more comfortable or better. Yeah. Because I think seeing things as a problem is where we fell into this pothole of, posteriors are bad and breeches are bad and all the villain. Oh, you're not progressing fast enough. This is bad. It's like, no, it's an invitation to do a bit of work. So I kind of like that lens a little bit more when I'm working with clients. I always like to clarify that because some people will be like, I need you to whatever. And I'm like, we're supporting.
I love that because also I'm quite big on mindset and I think words and mindset has a very big part in all of this.
Yeah, super powerful in the birth space, particularly when you're so vulnerable in pregnancy. You're so vulnerable. The language that people use, someone as subtle as going like, oh, your bump's pretty big. You go, oh my God, like, am I too big? Like, this is a problem.
So true, yeah.
Yeah, and they've made an innocent comment and you take it to heart because you're so vulnerable. You want to make sure everything's okay.
It's so true. Even from like as simple as being told, at 32 weeks and my baby was still in breech, it's really easy to fall into a lot of fear around that. And I think because there are so many OBs and doctors who aren't experienced to say birth a breech baby, for me, I had to like consciously be like, no, don't buy into this fear. One, you've got plenty of time. But two, even if she does stay breech, it's A-okay. There are so many options. But you're right. You have to be so careful along every step of the way.
Yeah.
With how you're receiving and responding from different comments.
Yeah, yeah. So the typical clients that I would see, I normally keep it to more birth prep work, but birth prep work does lead into pregnancy aches works. So I don't think that English made sense. Pregnancy ache work. But
we can make up our own language, yeah, for it.
I've just come off night shift on the weekend, so my English is like down here today.
One night shift worker and one pregnancy brain. We're killing it.
We're doing great. You know what? We're actually doing pretty well so far.
Yeah, proud of us.
The first slip up of language. So, so the clients that I'll see, I like to encourage people to come and see me whenever they have an ache, but you can also see heaps of different providers when you have aches, which is awesome because they all work with pregnancy aches. So pregnancy aches are your number one thing to go, I need to do some work, my body is cueing, it needs a little bit of help. Because it will start with just being like, oh yeah, that space is like a bit sore if I touch on it. And then you'll go to, I can't even walk without having pain. So that's the first thing I always like to see for people. And I'll see like a plethora of different aches, but typically it'll be normally pubic bone pain, glute tension, lower back, rib pain, round ligament pain. Yep. So your very classic pregnancy aches. And then I'll see people for birth prep. And in that can be breech babies, high head babies, post-date babies, multiple babies. I see a couple of twin mums going for VBACs, mums free birthing, mums home birthing, like absolute plethora of different women that I'm caring for.
So with some of those common aches and pains, let's say like pelvic girdle pain, what are you seeing as the reason for that happening?
There's too much. It's just so unique. I think pre-existing aches is a really big trigger for a lot of people because your body's already saying, hey, I'm struggling. And then you get pregnant and it's working even harder than it ever has, changing rapidly. And yeah, how can your aches not get worse after that? It doesn't necessarily have to be that ache getting worse. It can be the flow-on effect to several different areas because the body's connected. So if one thing's struggling, it offloads its work to someone else and say, you help me because I can't do this. And muscles don't really enjoy doing other muscles' jobs. So then they get pissed and they offload their work to someone else. And it's this ripple effect, absolute ripple effect. So pre-pregnancy aches are a big one. So if you're planning on getting pregnant, see someone pre-pregnancy to address your aches and pains. Don't just be like, oh yeah, it'll be fine. Like, no, address it beforehand.
Yes.
It's so valuable. So that's kind of like one of my main things that I'll see pre-pregnancy aches. Yeah. And then the rest, jobs definitely really leach into it. So a sitting down all day job, hairdressers, bless them. My God, their back pain is horrific in pregnancy because they're standing all day, they're leaning all day, they're doing all these unique positions where their bodies, body workers, chiros, osteos. But generally those particular clientele are seeing people pre-pregnancy to address their aches. So I find that is kind of a really big.
Yeah, I guess our society isn't really built for pregnancy, is it? So conditioned to just like push through the whole way.
Oh my God, if it was built for pregnancy, we'd be on mat leave from 4 weeks pregnant.
Yeah.
Like, and we're not. It's just like you keep working until you can't. And pretty much everyone gets to the 36-week mark and goes, I'm done. I'm so burnt out. I'm trying to look after other kiddies. I can't even focus on my baby. I don't even know if my baby's moved today because I was in back-to-back meetings. Like it's just, it's not built for pregnant women, and it should be. Because like family is that center point, I think, of society. Well, 100%. Mum, well, baby, well, world. How I feel.
100%.
Yeah.
So what are some general like tools and recommendations that you have for people throughout their pregnancy to support them?
Body work.
Yes.
Easy. Easy decision. I am a really big advocate for working the mindset. Pregnancy is not easy. As much as I think people want it to be, it's not. Your body's rapidly changing. There's a lot of mental health things around how much change your body goes through, particularly as soon as people get really swollen and they're like, my face looks different. I don't recognize myself. I've got cankles. I've never had this kind of swelling before, or I'm so unwell. I'm on bed rest. Like I can't even do the things that feel good for me. Like it can be really hard pregnancy. So mindset's huge. So I think if you're going to get into the meditative practice, pregnancy and pre-pregnancy always is a really great road to go down. I'm a really big fan of kinesiology at the moment.
Oh yeah,
really
love kinesiology.
Yes, I'd never. That was probably like the one provider that I had never seen. I see like a million because I invest all my money in my body work because I'm like I need to feel great all the time.
Yeah, love it.
Yeah, and as soon as I started seeing a kinesiologist, I was like, oh my God, I've never learned so much about my body. It's that mind-body connection. So I think that's incredibly valuable. So if you can find a provider who can help build on that mind-body connection, you're going to be way better off in pregnancy because you're going to get an ache and you're going to go, what's that? How can I support that? Oh, my baby's moving this way. I think people should be concerned if they're not sure where their baby's usually sitting or they're not sure how their baby's usually moving. And because I see this because I ask women, I'm like, where do you feel like your baby is? And they're like, oh, I don't know. And I'm like, what do you mean? Your baby's with you 24/7. They're like, oh, my doctor just tells me this. And I'm like, where's the self-power? Where's the ownership? Where's the awareness? That's a really important one. How do you know if you're well?
It's
if
so
you can't feel your
important,
body,
isn't it? Yeah, it's so important, and checking in.
Yeah.
I actually love the story you told me the other day about a practitioner I used to know who used to work with women who had breech babies. And she would solely use manifestation, meditation, and visualization to turn babies.
Yes.
And I was like, I mean, I'm so big on manifestation, so I love this stuff.
Yeah.
But it was so interesting hearing what her success rate was with doing that alone.
A client was telling me that she was just who every home birth midwife would send their breech mums to because she would have a 7 out of 10 success rate of meditative practice with helping these babies turn.
Even after you told me about that, I just went home and YouTubed like a hypno meditation for turning breech babies.
Oh,
and
yes.
Even that alone was amazing.
Did she get wiggly afterwards?
So wiggly.
Oh, so
it was the most powerful 30-minute meditation. I was like, this is amazing. And I felt so connected to my baby. And I was like, this is just so wonderful. Like I really felt connected. And I'm so glad you had brought it up because again, like I had also been quite busy and I guess kind of fallen into that trap of running around, and it was just really nice to just lean in and now lean in more to having those moments with my baby and really deeply connecting and asking things from her.
Yes.
Like, hey girl, give us a little turn in there. Let's go, you know? I guess this is so relevant for any position that a baby is in, whether they're just not placed right, posterior, whatever.
Yeah. I've even seen some aches. I've had a few clients who have had like pregnancy aches that I could not troubleshoot. No one could trouble. They'd see providers after providers, and a little bit of that connective meditative work, particularly around sacrum, pain gone.
Wow.
It was crazy.
So what other signs are you kind of looking for? I know like as we get more pregnant, we get this big line on our stomach, and I know that's like a big thing for you in your work, looking at what that means. So what are some other things you're looking out for?
The pregnancy line, so the tummy line was a really cool one. I just noticed that. And then I was like, oh, that's weird. It kind of connects with people's pain. And I was like, oh, I can kind of use that to work out the tension. Hey, baby's kind of connecting with that as well. Like it was a really cool one. So I'll use the pregnancy line a lot.
Yeah.
pregnancy aches, because a mother's body cueing what's tense and what's sore is a really big component of it as well. Labour signs, people getting different labour signs will help me troubleshoot. So I see a lot of mums who are in early labour as well in my clinic, and I'll use what kind of sensations they get, not only where, but for how long, is it stop-start, so I can work out what might be happening. Blessing the 7 years of midwifery work, you see a lot. So when someone comes in early labour, you go, oh, you might be working with this kind of position. Yeah, that feels about right for the baby. You can tell a lot of information from the baby's head, a lot of information from the baby's body, so that where their bum is sitting. Tension, you can just palpate tension. It's really, there's so much information there.
It was amazing how after you worked on me and you really opened up the space in my abdomen and around those right abdominals, like I had said before, and by the end of the session, Bubs had risen another 2 centimeters away from my pubic bone, which is incredible to see how much space that there actually is in there, and with a little bit of encouragement and muscle softening, Bubs could move.
Yeah, I see that with breech babies. That's when you know that they're more likely to make the decision to turn, because they will shift themselves up and try and turn, either by the end of the session or definitely in the days following. But the baby who wants to, and that's how sometimes you can pick a head down versus a breech baby, because some of them can honestly feel really similar. It can be really tricky to pick. And sometimes I'll say to a mum, I'm like, look, it's actually quite hard. Let's just start the work and see how your baby responds. Because the work's not too dissimilar. I might just focus on different areas, but it's all about softening and creating space. And the baby will do whatever they want with that. And so with breech babies and non-head down babies, I will see them move higher and adjust. Like they're saying, oh, the space is opening for me, let me turn. And they'll do so in their own time. But a head down baby will go, thank you so much for making this room. Let me wiggle right in there. Some breech babies do that because they want to be born breeched.
Yeah. I remember you saying that.
Yeah.
Like some choose.
They all choose.
Yeah.
They all choose whatever based on what's around them. And it's not just tension. There's heaps of factors, but it's a really big component. And it's one that we can influence. Because sometimes you can't influence where the cord is or the placenta or the uterus shape. Like you can't influence those things, but
well, that's it. What can be some other reasons for it? Like I know having, say, an anterior placenta could be, you know, I guess reducing movement and different things like that. What do you think are some of the reasons?
There's heaps. Kind of what I've said, like uterine shape is a really big component. Cord, how it's wrapped around a baby. And the only way you can know that is retrospectively, so after a birth. And that'll normally be in a cesarean, where I've had a client recently, a midwife herself. We did so much work together to encourage her baby to turn. She was umming and ahhing about a breech vaginal birth. She wasn't too sure about it and ended up going to labour and decided for a cesarean. And like her baby never shifted in our sessions. They would just descend. And I was like, I think your baby's saying they want breech. And unsuccessful ECV as well, where they try and turn the baby. And so in her cesarean, she said that her baby had a really short cord. And she was like, for a midwife to say that, you go, oh, okay, must have been, pretty decently short. So this baby in its intelligence knew that if they turned, there might have been more pressure on that cord, reduced blood flow to them, survival and safety was at risk. They chose their safest option. Even if it's not what we deem safe, this baby knew this is how I survive.
Can we talk about that? Why isn't it deemed safe?
It's a annoying topic because it's a really old one and it's a really well talked about one. From I can give you some little dibs and dabs of it.
Give us some sprinkles.
I'll give you some sprinkles of it, but there's a very good podcast that talks. So Great Birth Rebellion is an awesome podcast for anyone. Even if you're not pregnant, have a listen to it, because it's an awesome podcast with lots of really good evidence-based research and papers and statistics, and it's great. And so from that podcast, they talked about a study that was done in the 2000s called the Breech trial, where they looked at, I think they got up to about 2,000 women and looked at basically the safety of breech births. However, there were a lot of flaws with the study because they didn't separate the injuries that babies sustained in a birth. So they grouped together neurological problems following the birth with bruised testes from a birth, which can happen because they're breech. Or they included unskilled providers with skilled providers. And so they actually had to stop that trial early because there were really poor outcomes, and they put it down to breech.
Interesting.
But a head down birth can be really unsafe if you don't have a skilled provider around when you need one.
Yeah.
You can birth on the side of the road totally fine, breech or head down. But it's when there's shit going down that you're like, okay, I kind of want someone with skills around. If you don't have anyone with skills around, there's your poor outcomes, regardless of the position of the baby. So there are a lot of problems around that study. I found it really interesting when I read a book, and I didn't know this. I read a book called The Breech Release, which is a fantastic book. And it's not a teaching techniques, it's just discussing breech babies. And they reference a study called the Promoter Study. Okay. And it was done in 2006, looking at the French-Belgian border, where there is a hospital there that was doing a lot of breech births, very skilled. And they had almost no poor outcomes in 8,000 women.
Oh, wow.
Because it was skilled. And reading that, it was just a light bulb. It was like, oh, the problem's not a baby, it's us. And to get like 100% success rate in any scenario, that's not human. You can't. No one's perfect. Things happen. But I thought that was really fascinating, but then no one talked about that. And I'd never heard about it, but it was done back in 2006, 6 years after this huge breech study came out that basically blacklisted breech births. And so that choice was removed from women. But there's a really interesting movement happening at the moment where women, and I'm seeing it because I've got clients and they come in and they say, well, I always ask them, how do you feel about a breech birth? And they'll either pause and go, no one even told me I could do a breech birth. Or people will go, yeah, I don't really care. I had a home birthing mum and she had a breech baby and we were just like doing some work together. And I was like, oh, how do you feel about a breech birth? She was like, yeah, head down, bum down, I don't care. Second baby, confidence, 100%.
Love that.
And she was like, yeah, whatever. But her baby had turned pretty late, like 38, 39 weeks.
Well, that's it. Fine. After having the conversation more and hearing how it's a lot more common in certain countries overseas, and especially third world countries, I believe, right? Because they obviously don't have the tools as much to help breech babies turn. So they just birth like that and they have an okay success rate with it. But it's so interesting to know that now a lot of just our doctors and OBs, they don't have the experience to be able to facilitate it. Yeah. And that's why we can't do it. And I feel lucky that my OB does, but I feel so much more empowered now knowing that there are so many options. There are, yeah. Skilled provider is the number one. So if you were birthing in like the public system and you were deciding on whether you wanted a breech vaginal birth, I would always say see who's on because it's as safe as the person is skilled. Yeah. When you've got the beauty of continuity and you've chosen them and they say, I do breech births. And you go, great, what are your skills in it? And they'll say, da-da-da-da-da. Awesome, amazing. It's going to be safer for it. It means that you've got a better option. Yeah. It's really hard when just women aren't given options. Totally. Yeah. And there's also so many other great tools out there that, you know, I've recently learned about to assist in this process and might be relevant for anyone listening. But Spinning Babies is an amazing platform to assist with getting a baby into the optimal position for birth. Yeah. Even acupuncture and moxibustion, which my partner is very lovingly every night been sitting on the couch while I'm upside down on the floor and he's putting this hot wand stick on my little toe. It sounds completely woo-woo and crazy, but all these different modalities have been seen to show some really great results with putting babies into the appropriate position for birth. I think that's because there's so many options to choose from. Yeah. And so you can address what your body and your baby need because every baby needs something different. Every baby is breech for a different reason. I've never been able to do the exact same techniques with the same mum. You can't. You just genuinely can't. You can look at the same areas. No one responds the same. So why would, if someone comes to see me, I'm not expecting 100% success rate. Someone does acupuncture, I'm not expecting them to have 100% success rate. You can't. Everyone needs a different thing. So do everything. So then when your baby says no breeches for me, I go, okay, baby, I trust you. I trust your intelligence. You have all the information and I'm just going to do what I can. So what are some of the most optimal things a woman can do in pregnancy to try and have a physiological birth? Body work. It's just going to be your answer for everything. Just body work. You need to be soft. You just want that softness. It's just giving babies more options to choose their best position to get out because they can. And if they need to be creative in the space, it's softer for it. Like they can navigate it differently and that's awesome. So bodywork is a big one. Mindset's a huge one. I spat some absolute gold at a client the other day. Sometimes just like gems just pull out of the air and I'm like, this is amazing. I should write this down. So I wrote it down so I don't forget it. The client I was talking to, preparing for a vaginal birth, she said to me, I was like, oh, what are you going to do to like help get through like your labor? Like, what are you planning?
And she was like, I'm just going to see if I can handle it. And I went, oh, well, that's not a great mindset to have. And I said to her, instead of saying, can I handle this? Instead of putting that restriction on yourself, because you're going to come into a wall, you're going to hit a wall where you're going to be challenged in how you feel like you can go on. Every single woman has this transition. It happens in transition all the time. You have a 50-minute labor, you have a 3-day labor. You're going to think multiple times, this is so much. Oh my, I don't think I can keep going. This is so hard. And if you have that mindset of, can I handle this? Your brain has just instantly said no, and you're giving yourself a door out no matter what your goal is. So I said to her, I was like, instead of saying, can I handle this? Instead say, what tools do I have to get through this? So then that mindset is shifted to, how can I support my body right now when I'm asking for help, rather than get me the F out of here. Let me numb my body, or let me just exit labor at this point, regardless of what my goals were. And she had that light bulb moment of, oh, I see how my mindset was really restricting myself. And I was like, yeah. So go through the list with your partner, write down, if I have this sensation, this is what I'm going to try. So if I have back pain, I'm going to start with a heat pack. I'm going to do some hip jiggles. I'm going to get my partner to do some sacral compression. We'll shake the apple tree. We'll go into a sideline release. Then if I have hip pain in my labor, this is what I'm going to do. I'm going to do a sideline release. I'm going to, whatever it is. So setting yourself that plan of, this is how I'm going to work through it, rather than, can I handle it? Your brain's going to say, get me the hell out of here really, really quickly. It's labor. It's really intense.
I love that. And also getting your partner on board with different affirmations and things they can tell you when you are in that place, just to help pull you out of it and support you. I think it's really important. I'm in the process of making my birth vision board at the moment. And so I've got all my affirmations on there and going through my birth preferences with Sean. But you can really see how doing that preparation is going to help.
Yes, your support people are key. They're on your team, they're in your corner. If they don't have the skill and the knowledge that you do, it's going to be really hard for them to support you. And it's okay if you don't feel like your partner will actually fulfill that role for you. They might fulfill maybe 30% of what you need in a labor, and then you might want to bring in your mate or your sister or your mum, or hire a doula, or do all three things. Because you can't expect one person to do everything. Very few people have like within a couple of hours labor.
Yeah.
If that was the case, one person, you'd be like, yeah, that's fine. They're going to hit a fatigue point. You need 100% from that support person, because you're going to be running on less than 100%. And if they're fatiguing, and I've seen it a lot, where partners are like, oh, my back's hurting, I can't keep doing these hip jiggles, and she needs that to get through it, and then that's just been taken away, that comfort for her. The next thing she'll go is, give me the epidural. This is too much, because I've just lost my support because he's just fatigued. Instead of just having someone to tag in. Like the second support person can be for the main support person. They haven't eaten in 10 hours. Send the mum down to go and get the partner food so he can stay with you.
Like, we've got a support person now, and
good.
I think she knows Sean well now. So I'm like, this is great. You support him to support me.
And that's what it is. Because you fill in your potholes as much as you can. Like don't leave any space on the road. Like just all the support that you can. Know that you're going to get 100% from everyone, because you need that. If someone starts wavering, you're going to fall down too.
What about stuck in early labour? I know you briefly mentioned something about that at the start of the episode, but what would be some of your suggestions for people who are finding their labour is just not progressing?
I always gravitate towards asking, what do you feel like you need to do to get through what you're feeling? Because your body is communicating a message. So if I say that to someone and they then say to me, I need to lean over, I'm thinking, okay, you're trying to create space at your sacrum. You might be trying to stretch that out. Let's see if we need to do some work here. So I'm always thinking of, if there's a stall in a labour, why does the body feel like it needs to pump the brakes? What's it working on? What do you feel like the baby actually needs in that moment? Because not all contractions are dilation contractions. And this is something that you learn purely through observation. It's logical to think that every contraction is going to result in dilation. Otherwise, then you get that classic textbook, every hour I'll dilate a centimetre. It does not work like that. I've seen people go from 2 to a baby in 40 minutes.
Yes.
Tell me how that works. I've seen someone dilate a centimetre in 10 hours and then just like bam to birth, like in 30 minutes later. Like It's not a linear thing. So
This is where the conversation has to change, doesn't
Yeah,
it? Because it's surprising how that's not really a commonly looked at thing in hospitals.
because it's bed flow.
Yeah.
You can't have someone in there for hours not doing anything because firstly, if it ends up in court, there's potential for negligence. So there's a legal aspect for it. Like, oh, she wasn't progressing. Why didn't you offer her care? Oh, we're just going to see what the baby did. You could see how that could get really messy really quick.
Yeah.
So there's that layered on top of, there's also 5 other people needing a birth bed. Let's just speed this along. So there's that. And I think both of those things are horrific when it comes to lifelong impacts on bonding with baby, trauma to your own body, mentally or physically, because everything comes with risk when it comes to an intervention. And if you're having a stall in your labor, they'll just be like, oh, you're not dilating? Let's just use the hormone. Oh, your waters are still intact? Let's just break them and see what happens. And they can work for some people, and that's okay. They can, but they bring risk. So you just have to weigh up your risk. I think it's better to have the perspective of what does the baby and body need right now to actually support it in doing what it's actually doing. It's not, false labor is like one of my biggest trigger words. And people will say this a lot when someone's like stuck in early labor, because they'll be like, oh, you're not dilating, but you're getting contractions, so it must be false labor. It's like, there's no such thing. The body's just not working on dilation right now. It's working on either positioning a baby or helping a baby to rotate. And you'll see it with different contraction patterns. And that's why asking a mum several questions. What do you want to do to get comfortable? What are your contractions doing? What's your pattern? Are they close together? Are they long? Are they strong? Are they dull? Are they all over the place? Where's your baby sitting? Where do they normally sit? Because people will feel babies popping in and out. They'll feel babies rotating. You'll feel all this in your labor. You're not just numb from the body down. But if you are numb from the body down, you're not going to get that message.
Yeah.
And I don't think then we should be too surprised that labors don't progress. We've just cut off the only person who can feel her body.
So how do we encourage women in that scenario to feel like they have the confidence to speak up if they are getting pushed in a certain way? Because I can imagine the pressure would feel quite strong.
Yeah.
Also not feeling like they're the expert.
Yeah.
And I think that could be quite testing. And I think a lot of women would find that, and that's when they get kind of forced into a trajectory they probably didn't want to go. So how do you kind of encourage women to navigate those scenarios?
It's really hard to advocate for yourself if you're not informed and you're not connected with your body. So starting with just building on your mind-body connection, like it's much easier. So say, for example, for you, if someone was to say to you, if your doctor was to say to you, breech isn't safe, you should have a cesarean birth, look at your physique, you won't be able to birth a breech baby. And you go, get in the bloody bin, mate.
Yeah.
What do you mean looking at me, I can't birth my baby? Are you kidding me?
Yeah.
Because you've got that confidence in self. You're like, I know my body. I know what my body is capable of. Like, you know yourself. So you can advocate for yourself a lot better. Some people don't have that trust in self or are very intimidated by that power dynamic of someone knowing more information than them.
Yes.
And that's very tricky to navigate. So building on that mind-body connection and trust in self is probably step number 1. And that's not a pregnancy isolated event. That can be in your life. That should just be a skill for life. And you've got to build on it, because for most of us in our childhood, we weren't exactly taught to listen to our bodies. We were told to shush and be in the corner, because that's what children had to do. And now it's kind of coming into a beautiful different part of like parenting where we're encouraging children to be children. That's a whole different thing.
Episode 2.
So building that mind-body connection so that you know your body and you can advocate for yourself if something doesn't quite feel right. And then if there's that power dynamic at play where you're not 100% comfortable with actually speaking to someone, because they can be intense. I work in this space. I have felt silenced by some providers, midwives, doctors, doulas, like whoever they are. Some people are really intense and you go, oh, I don't feel like this is a conversation. You just feel like you're talking at me. And I actually feel really uncomfortable speaking my voice right now because I don't feel like you're really going to receive it. And so I'm a really big fan of being like, okay, thank you for the information. I'm just going to take a step back. I'm going to think about it. I'm going to do my own research and then I'm going to come forward with you and we can have another discussion about it. Yeah. So kind of removing yourself from that situation can be really helpful. It's trickier than if you're in labor because you can't really step out of that space. So I'd be like, can I have 10 minutes to think about it and talk it through? And choosing what feels right for you is always going to be the number one thing.
You're so right. Education is truly everything. Like I feel like I've taught myself so much already in the last 8 months. And something that was really interesting was when I had an internal pelvic floor assessment recently.
Yes. How did it go?
That was not what I was expecting. I did not realize there are so many spaces up there. There's a lot going on, but it was fascinating because a lot of the pressure points and things were correlated to the muscle groups on the exterior that we're used to working with through massage and bodywork and different things like that. But I was learning a lot about my own pelvic floor, getting a lot of understanding. And it's also really interesting to learn that the left side of my pelvic space, there's a lot of space. So there is good room for baby to move, whether she's head down or breech. And just learning different things like that and empowering and educating myself on the different aspects of my body and that I am capable and things like that has transformed so much.
Yeah. I've just recently done the internal bodywork course.
Yeah,
and
right.
we have to practice on each other as part of that.
Oh, wow.
So I received many internal bodywork sessions.
Wow.
And
it was actually so good. I feel like we should be doing this when we're not pregnant.
Just as women.
Yeah.
Yeah. Fiona Hallinan is an absolute
I saw one of her employees.
To maternity. Yeah, for women's care. And the way that she speaks about it is educating yourself on your goods is the words that she would say. Yeah.
They are the goods.
But you don't realize how much room you have. You don't realize, like people will just think, oh yeah, vagina's like this long and it's got like this much stretch to it because that's how comfortable I am with sex. And I'm like, mate, you can feel all the way to the sides, all the way up.
It's wild.
You don't realize how big your space is. And then you go, hell yeah, a baby could fit out of here. This is a lot. But I do find it really interesting when you notice that left to right difference. And then in your life you'll go, oh, I am normally more sore on my right side. Like, oh yeah, I do get a bit more discomfort there. And that's reflected in my space. I wonder how my baby would respond to that. It's really cool. Everyone should have it done. But it's great that you had it done in your pregnancy.
Totally agree. Yeah. That's so cool that you've done it.
Yeah,
I love that.
Yeah. Oh.
Just another notch to your belt.
It is. You need so many skills because everyone needs different things.
Well, that's it.
Yeah.
So I do just really quickly want to touch on some of the other like kind of misconceptions that you would probably see a lot. What are some of the biggest ones that you would probably want to set straight?
Let me write them down. I wrote down a couple in the heated moment.
Right.
I was like, we need to talk about these.
Yes.
The urge to push when you're like 4 or 5 centimeters, if that, because people will assume, I think from the midwifery and the obstetric perspective, when people have an urge to push and they're not fully dilated, there's this hysteria about getting a swollen cervix because a swollen cervix, decreased blood flow, doesn't exactly dilate, babies don't come out, they often end in a cesarean. And looking at it from why does the mum have the urge to push? No, it doesn't make any sense because she's not fully dilated. What other purpose is it serving? It's not she's just getting the wrong sensations. She's getting the exact sensation she needs to turn this baby. She needs that extra pressure. We should not be silencing her body, but we should be investigating why she has the urge. We should be giving this baby more room so it can turn so that she doesn't need all this extra pressure on top of it because the cervix can swell. It can also de-swell. Think of like a ring on your finger. If it's really, really tight, it gets really swollen. The blood flows decrease, it gets super swollen. All you have to do is relieve the pressure on it and then the blood flows back and then the swelling's gone. It's not a difficult thing to resolve. And I've seen it in quite a few labours when I've worked with mums who had this exact scenario. You chuck them in a puppy pose with some hip jiggles for a little while. We want to think that inversion part of it because we're getting baby off the cervix. It's not only that, you need to get baby off the cervix to improve the blood flow, but then you also need to give the baby room to navigate the space because your baby already said, this was really hard for me, I've had to get into this different position. So just looking at it from a different perspective is very, very important. I think when people understand that, they'll go, I see why she had an urge to push. There's heaps of signs before that though, before you even get to that. So I in no way would be waiting for someone to have an urge to push. But that's a really big one because you'll hear this absolute fear around a swollen cervix. And I'm like, you can address it, but also you should be doing the work before someone even gets to that end. Yeah. That's very late stage.
Yeah.
Yeah. So that's like a big one.
Yeah. That's great. That's really empowering for women to know.
Yeah.
I think for me, a big one has been it's so easy to fall into the trap of seeing things on social media and kind of rolling with them. And I was very, very big on strength training throughout my pregnancy, which I am a big advocate for, but you really have to adapt everything to your body, and that's something that's probably not conveyed across social media. And I realized that a lot of the exercises and things that I was doing, that I was idolizing pregnant women for doing, whereas actually causing me the reverse effect and not a good thing for my baby to do. So such as things like really deep squats are really bad for when you've got a breech baby, because you're pushing that baby right deep into your pelvis. And, you know, when I came to see you, I was like, oh, you know, I've just bought these like SRC compression shorts that everyone's like, you should wear. And I thought that would help with a little bit of the pain I was having. And you were like, no, because you're trying to soften right now. And so, it's okay to use them sometimes, but you don't want to be rolling around in clothes every day that are causing tension and tightness. And I just see these as some massive misconceptions that are so easy to just fall into the trap of and listen to the people around us without actually having that expertise.
The compression clothes can be awesome when you have pain and you need to go to work for like 8 hours and you know you're going to be in agony by the end of it, or you need to go to the shops and walk around for a bit. They're great. They're awesome. But they're a Band-Aid.
Yeah.
Like, you know, maybe stop putting the Band-Aid on the wound and just look at why it keeps bleeding. Like it's kind of like that. So I'm more of an advocate for it's a tool to use, but you shouldn't be dependent on it. If you're dependent on it, there's a huge problem at play. I hope you're getting work on the side as well as using those to improve your comfort. Because most of the clients that I see will often say to me, oh, I really don't need my compression wear anymore. Like, yeah, because you address the tension. Yeah, it's really interesting. So I think that's definitely a misconception, the overuse of that, or definitely like the dependence on it. Some people need it a lot, but I think you got to get your body work on the side. It's not enough to just wear something tight, because as soon as you take it off at the end of the day, it's like tight bras. You go, oh, it's so much better. And your body has literally just said to you, that was too much for me. Thank God you took that off. And then you go put it on again the next day. And then your body learns, we can't keep managing this pressure. We're going to get tense to deal with it. There's your tension.
That's it.
Goes right into a pregnancy.
Yeah. It's so great, because I feel like this is really highlighting the importance of how individualistic everyone's experience is, and how important it is to do the work throughout your pregnancy, and to really learn and understand your body, and to feel really empowered going through the process and through birth and labor. Yeah.
There's another really awesome misconception, or even just overuse of a position. Everyone will often say like, oh, don't sleep on your right side when you're pregnant, sleep on your left, because you want a left-sided baby. And that's what I was taught as a midwife. Yeah, you want a left-sided baby, because the idea is that in labor, they come down like left transverse, left anterior, and then they turn to the front and pop right out. Smooth, easy sailing. I cannot tell you how many babies I've seen try and get to the right side to engage and then go down. And they're the ones that'll be that like 4 or 5 centimeter posterior baby. Like, they were on the left. Why didn't they choose that position? Maybe because the right was shut off for them. And so this baby was working with positions A, B, and C, when in fact they needed position E, but it was closed off because of tension, because they kept sleeping on one side and ignored their pain at night.
That is fascinating.
It's depressing. Because everyone's told that. But it's more about listen to your body, keep both sides soft, your baby will choose. We cannot try and tell a baby where to go. We need to give them the option to choose. Our job is just to give them options. They can make the best decision. We shouldn't be thinking left is best. I'm more of a fan of give them both. They will choose.
Well, I am very relieved to hear that, because I have been sleeping on both, just because my right is so much more comfortable, but I am flipping around a lot.
Because if you're uncomfy and you're not moving, your body then goes, well, you can't keep being uncomfortable. They're going to get tense to support you. Tension. The right side's gone at that point. You're so tense from it. Also, the left side's tense at that. Like, it's just, you're shutting it off if you're ignoring pain.
There are so many little hacks that are so great. The other thing that I was doing wrong initially was, and I think this is quite a common one, is on the birth balls or exercise balls, Swiss balls I should call them. They really have to be a larger size for your body. So we have one at home that was quite small, and my legs were positioned when I was sitting on it that my knees were above my hips.
Oh, yes.
And that is a big no-no. So
unless you're birthing.
Okay. Well, you can elaborate on that. But I quickly realized that now I needed to get a big one and make sure that I was in the correct position with my knees below my hips.
Yes. Yeah. It depends on the stage. So the knees lower than hips is more helpful for engaging a baby. The knees higher than hips is helpful for getting a baby out when you're pushing.
Yes.
hence why you see a lot of women pushing in like a squat position or like knees elevated.
Yeah.
Not too many women choose the straight leg birth position, but everyone's different. They need to do what feels good for them. So you might have been sitting on the deep squat ball and gone, this feels awful for me. Or you might have, I'm more of a fan of follow your aches and pains. But that's one thing that I've heard a lot of. But again, it comes down to your body, because you might try that and go, no, deep squat feels good for me. Because maybe your baby is trying to engage a little bit more in that position for your body. So
what's your perspective on birthing on your back?
Not a fan. I've seen women do it.
I think that's another really big misconception, unfortunately, mainly because of movies, I would say.
Movies. Oh, my God. I reckon it's men directing movies.
Yeah.
I reckon it's that, because I think if women were directing like the birthing scenes, they would not be depicting it as they are.
No.
Because women who birth go, I wasn't screaming like that. No one was holding my legs down. Well, some women do have that experience and it's awful and it shouldn't. Yeah.
So why is it not optimal for birthing on your back?
Think about the main birth, or the main bone that has to move for your baby is your sacrum. So it's a beautiful diamond bone at the back. It's where your tailbone is. That has to lift and open for your baby to come out. It's how it moves. The front of the pelvis, so around the pubic bone area, doesn't move. So if you're on your back and you've got a compressed sacrum and your tailbone's lifting up and this baby's trying to get past it, they're like, man, I can't get past this. I'm going to wait right here. You just end up in so many more instrumental births. I've seen it work for some women. Their baby in their body just needed a different position. I've said to women, do you want to move? You don't have to lie on your back. And they're like, I can't. And this baby will just rock it out because they've chosen a position that works for them. There's so many more women, though, that say, I knew I needed to move. I needed a towel under my back or something. I just needed something different. I knew I could get my baby out. And they kept telling me, don't change this position. You have to be on your back. We have to see what's happening. I think there's a lot of distrust in birth when that's what's happening. If a provider's like, I can't see, so I don't know if it's safe. And I'm like, is there anything concerning even happening? Or do you just need to see birth? Like, yeah. So I'm not a big fan of birthing on back. I wouldn't rule it out because some women do choose it. But in no way would I ever say to a woman, oh my God, you're fully dilated. Let's go on your back. Ever. I would never. I'd be like, get in the bath.
Yeah.
Your baby's coming, get in the bath. If you want the water birth, get in the bath. Yeah. Or like go sit on the toilet, hop in the shower, be comfortable. This is an intense part of meeting your baby.
Yeah, that's it.
Yeah.
There are so many topics we could delve into. Yeah, you're a wealth of knowledge.
Yeah.
And for anyone wanting to delve deeper into your work, you have a ton of resources on your website and courses online, and clients can come and see you if they're in Melbourne. I do like to end my episodes by asking our guests to leave a little verbal entry in the Test Talks diaries. So is there any lasting advice or wisdom you would like to leave behind?
No one can ever know your body better than you. So if you don't know your body, no one's got any chance. You need to build that relationship of mind-body for just in life, but particularly in a birth. You're the only one who knows where your baby's sitting, how your baby's feeling. You're the only one who knows. You got to build on that relationship. It's so important.
I love that. That's such an important message.
Yeah. Yeah.
That's a really
only you know you.
Yeah. It's very empowering. Thank you so much. I really hope that this episode has left women feeling empowered and confident, and that knowing there are so many options for whatever stage they're at in their pregnancy.
Yes.
Thank you so much.
No worries. Thank you for inviting me, Tess.
Thanks so much for listening. If you loved the episode, please subscribe, rate and review. It honestly means so much and helps to keep these conversations going. And I'd love to connect with you. You can message me on Instagram or TikTok, and I've left all the details from the episode in the show notes below. I'll see you next week.